Hey, everybody, and welcome to All About Health and Wellness. I'm Dr. Kevin Usry. We're sponsored by All American Wellness, and we're brought to you by Podcast Junkies. If you want to get your message across to the masses, podcastjunkies.com. It's Junkeeze. See Christian Perillo or Ben Castro and talk to these fine young men about getting your message across, and hopefully people will listen and respond to what it is that you want to communicate. Today, we're going to talk about knee pain. Patients come to us for a lot of different reasons, and one of the reasons is they're experiencing knee pain. A lot of times you think you need to go to an orthopedic surgeon. You can, but you don't always have to. The most conservative and common reason people have knee pain is they have muscle dysfunction, or they have issues where their nutrition is not up to par and it's affecting how the muscles function. One of the things we do after performing a thorough examination, as is done in any chiropractor's office. So I'll talk to you about what chiropractors do and then what an applied kinesiologist would do. A chiropractor is, again, going to look at your posture. They're going to palpate your knee for swelling and areas of tenderness and pain. They're going to look at what your range of motion looks like. They're going to take a thorough history of when you're having these problems. And this is because they are thorough practitioners of musculoskeletal issues. They may adjust your knee if they find you have a disrelationship in how the knee bones are moving. And many of them use different approaches. They may use an instrument like you saw me use last week. They may use something like called a drop table. It drops about that much, and the speed of the drop allows them to make the adjustment quite comfortably. And for a lot of patients, it's very helpful. It can be followed up with things like ultrasound for people who have tendonitis, electromuscle stimulation for people who have spasms, or like what we do in the office, class 3 or class 4 laser. This is a class 3 laser. It is also known as a cold laser, and it provides healing light that is both red and purple. The healing properties of a laser have to do with the wavelength, and when you're talking a wavelength, you don't talk about inches or feet, you talk about nanometers. So anything that is 460 nanometers and below to around 400 gives you a blue to purple light. Anything that's 660 nanometers or down as far as 636 gives you a red light. The reason the laser is called a cold laser, as it goes into the cell, really more because of that red light. That red light functions at the same wavelength frequency as our cells, our human cells. So it's very easy for this light to get into an area, and it produces no heat. And so it can be used for chronic conditions and acute conditions as well. And it is simply miraculous what it does for pain and inflammation and dysfunction. So we'll just take a look at what that looks like. You can possibly see the purple and the red, and you can kind of see it blinking on and off. That has to do with the frequency. Frequency has a lot to do with what kind of a physiological effect you're going to get from the laser. It could be helping something in the body decrease inflammation. It could be helping something function more efficiently, such as our mitochondria. And at times we use laser for people who have dysbiosis or issues in the gut where they have microbial overgrowth that they don't need, and the laser can help by disrupting those microbes. So that, along with herbs, helps the patient get better from those areas of dysbiosis or microbial overgrowth. Today we're going to just look at the knee from a kinesiological standpoint. When you see an applied kinesiologist, we will check all the muscles around the knee. So let me show you now. So let's say from last week, we had our beautiful model Heather Klein. She had a problem in that left leg. It wasn't functioning as it should. So we're going to test that particular area and see if all of the muscles that insert and help the knee with stability are functioning normally. So let's go ahead and do that now. First thing we're going to look at, lift this leg up for me, please. Now let me push it down. Okay, so this muscle in the front of the thigh called the rectus femoris is working. It attaches right below the knee. We're going to check something called the tensa fascia lata, which clinically, when we see this area to be dysfunctional, can have to do with the person's nutrition status in the way of iron. So is it possible to have knee pain? Is it possible to have hip pain and be tired? Yes. If you're iron deficient, you can be anemic when it's very deficient, or you can just have pain on the side of the knee or on the side of the hip. Heather's is doing fine. We're going to now test that muscle that was functioning normally, and we're going to stretch it. Just stretch that whole area there and retest and hold, and that's functioning normally. Now, if a person was deficient, say in B12, in addition to maybe having some difficulty with their thinking, problems with their energy, we would also see these people complaining of stiffness and soreness. That's because that specialized tissue under the muscle that has to work in conjunction with the muscle and in a cooperative fashion, we call that fasciitis. The fascia is irritated and inflamed and not functioning normally. So when we find a muscle that's functioning normally and then we stretch it and it doesn't function normally, we know from a clinical perspective and years of dealing with these type of issues that that is a B12 deficiency, and we start patients on B12. We may do we call a hypothalamic reaction. We test the particular nutrient in the mouth. We give it about 30 seconds for the taste buds to send a neurological message through the brainstem up into a special area of the brain called the hypothalamus, and we look to see if there's a change. And if in fact there is, we know that that's going to be effective at helping the patient for that particular problem. We're going to do one more muscle test. We'll have you bend that affected leg, please. And we're going to have the person turn their foot in. I don't know if you can see that angle properly, but I'm going to try and swing it out. And I'm going to ask that person to resist me. We're testing a muscle that's found right, I tickled her. We're testing a muscle that's found right in the back of the knee. It's called the popliteal muscle. We check it. And in this case, it's functioning normally. When I provide resistance, Heather's able to meet that resistance, and this is a normally functioning muscle. When it doesn't function normally, one of the things that can send us down a path for looking for diagnosis or an issue that may be causing it, it could be a gallbladder problem of all things. And we'll follow that up with further clinical questioning. Oh, are you noticing that you get a runny nose when you eat? It's a sign of bile salts being deficient. Are you noticing your knee clicks when you walk? Are you noticing that when you have fats in your diet, maybe time in the bathroom isn't well spent? This gives us indications for a gallbladder issue that may be affecting the knee and the function of the popliteal muscle. Because of time, I'm going to just tell you what we would normally do without demonstrating it. We would check the back of the leg, the hamstring muscles, which attach to the knee. So we would look at those for normal function. And many times that can be due to a person not having adequate nutrition in their system, causing that hamstring muscle to dysfunction. And sometimes when we see that dysfunction, we also see colon dysfunction, problems with elimination. So we're going to talk a little bit more about that. I'm done with the demonstration part. You got to see the cold laser. Heather's probably going to remind me about the percussor, and you'll have to turn in next week for that. In the meantime, I'm going to sit down and talk to you about gut health. So give me just a minute. Why don't you sit here, Heather, and I'll sit here. My dear, table for one. Okay. Okay, I think we're going to have to move that way. Let me see. I can come over here. Okay, good, 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 good.
Nope, you'll be on that one.
I'll be on this one. All right. Okay, there we go. So,
Wait, let me just.
You'll move them. You'll move them.
so give us a moment while we wait for our producer extraordinaire to not only wear that hat, but wear the hat of the engineer. So, thank you very much, Mr. Castro, for your excellent performance on getting the stage just perfect. Okay. Not used to following directions by a man. I'm used to Heather ordering me around. So please, Heather. And do you have any questions that I may answer on gut function? Threw one at you, didn't I?
You sure did.
All
Okay.
right, so let me just talk to everybody. Listen, if you're not going to the bathroom and having a BM that's normal every day, then something's wrong with your gut function. You should have a bowel movement, quite honestly, in conjunction with the meal you eat. So some people can have a bowel movement up to 3 times a day if they're eating 3 times a day. That is a normal gastrocolic function. But most people don't have that, so they think there's something wrong when they're going 3 times a day, even though they're eating 3 times a day. Now, let's talk about what happens. We're getting into the nitty gritty. Let's talk about when you're done. 4 wipes, 4 wipes. Any more than 4 wipes, and you got nasty, sticky stuff on your toilet paper, well, you're not digesting your fats right. You may have a gallbladder issue. You may have a colon issue. You may have a small intestine issue. These are all signs of dysbiosis. Dysbiosis means the wrong organisms are in your stomach, small intestine, or large intestine. We all eat yogurt, right? We're all told about prebiotics and probiotics. Yeah, here's the reason why. Those are good organisms, good bacterium, and you need that for normal function. But when you eat things that are not really good for you, when your hydrochloric acid levels are low, which incidentally is what you need to break your food down that gets in your stomach, and you know, we eat all sorts of things. We grab things and we don't realize they're laden with bacteria that is not good. They may have parasites in them. They may have all sorts of different organisms that, because we don't have hydrochloric acid being produced in our stomach, because we're not getting enough thiamine or zinc. Anyway, these particular foods laden with all these organisms that don't belong in our body get through the stomach into the small intestine and large intestine, and we start developing something called dysbiosis. Infections in the gut could be something called SIBO. Some people have heard of that. That's small intestine bacterial overgrowth. SIBO. We could develop gastritis because we're not making hydrochloric acid. I said that before. Not enough thiamine and zinc in your diet. You know, we eat these big chunks of food. We chew them maybe once or twice, sometimes as much as 5, when in reality you're supposed to chew your food 21 times. No one does. And they expect their stomach to break it down. And frankly, folks, your stomach doesn't have teeth. It depends on chemical reactions, such as hydrochloric acid, to number one, kill those bacterium or organisms that don't belong in the body, and to digest your food properly. Now, when you have these organisms growing in your small intestine and large intestine, you're bloaty as soon as you eat. You're feeling way too full in your abdomen after you eat. It's making a lot of noise. You're, pardon the expression, farting and burping all over the place, and you're just generally uncomfortable. And when you go to the bathroom to have a bowel movement, well, forget about toilet paper. You have to go to the shower and clean yourself. It's just way too involved. I'm sorry about getting into the nitty gritty on this, but we all deal with it. Like the Charmin commercial, we all go, right? We all want to go normally. 4 wipes, we're done, perfect bowel movement. If you're not having that, you got problems in your gut. If you notice that your mental acuity, meaning how well you think, how well your emotions are balanced, there is oodles of research that has shown the intimate relationship with gut function and brain function. And whether you don't know it or not, your brain is controlled, or your brain controls all your emotions. It's called the mesolimbic system. All your neurotransmitters are all dependent upon the normal function of the small intestine. Hey, you know what I just saw? My wonderful producer, Ben, self-adjusted his neck. Don't do anything like that. Don't go to the drugstore and buy any kind of drug that the pharmacist lets you buy. It's not good for you. Don't self-adjust yourself. If you're having a problem with your neck, with your spine, and you adjust yourself, why don't I give you a scalpel, and if you got a problem in your stomach, why don't you just cut it open and see what's going on in there? If you're not trained on how to do something, don't do it. Go to a professional. Shame on you, Ben. Anyway, sorry to digress. I think we're pretty much done with the gut and the problems that can go along with the gut according to dysbiosis affliction. There are certain things that you need to take into your body every day. I talked to you about thiamine. I talked to you about hydrochloric acid. Some people need enzymes. If they do need enzymes, probably their small intestine is not functioning as it should normally, but sometimes it does need a little extra support, and enzymes can be very helpful with that. Probiotics, absolutely very important in regards to large intestine or colon health. It really depends on where you're getting your probiotics. The amount that you find in yogurt are not going to be even nearly enough to help your gut function normally. There's nothing wrong with adding it to your diet. Don't expect that alone to be enough to keep a healthy gut. Anything else we can talk about? Prebiotics. Okay, prebiotics are wonderful. If you have a love for spicy food, kimchi. Kimchi is really great. If you like pickles, those are fermented foods that can help your body start to produce probiotic. That's why they call it a prebiotic. These are all healthy foods for you. Cabbage, coleslaw, sauerkraut, all of these things are helpful. But once again, if you're eating these and your gut, your small intestine, and your stomach are not functioning normally because you have a nutritional deficiency, it's going to give you gas, and you're going to be entertaining for others. So anyway, I think that's about it for what I wanted to cover regarding dysbiosis and gut health and how it affects mental function. Let me put my manager, Heather Klein, on the spot and say, is there anything you can think of, because you think like the average person in the public, anything you can think of that might interest people in their gut health?
Well, you did cover the gut and the butt, so I think we're done with that. I suppose you can cover nausea. You covered belching. You covered farting. But what happens when someone's just nauseous?
Someone's nauseous. The first thing we look for is a hiatal hernia. That is a problem with the diaphragm. That big muscle that's found right here, it's a dome-shaped muscle that lowers when we breathe in and comes up when we breathe out. We breathe in 16 to 20 and breathe out 16 to 20 times a minute. That's a lot of movement of the diaphragm. And when it's not moving normally, it can hit the stomach and cause irritation and inflammation of the stomach. These are people that feel they can't get a deep breath. They feel nauseous. They feel a pain right up in the upper part of the gut. They may notice that they're always clearing their throat. They always feel like they're dealing with something, and we call it GERD, gastroesophageal reflux disease. This is mucus and many areas of acid that come up through the esophagus, hit the throat, can actually affect your voice. And this is something, believe it or not, that starts with a mechanical problem in your neck. The phrenic nerve that comes from the neck goes to your diaphragm. If it's pinched, the diaphragm doesn't work right. The diaphragm's a muscle, so if the muscle doesn't function right, the stomach doesn't function right, you can get nausea. You can have many different symptoms with hiatal hernia. The last thing I'm going to talk about is the great imitator. My mentor, Dr. George Goodhart, who founded Applied Kinesiology, said if I could fix only one thing for people, it would be to fix an ileocecal valve problem. The ileocecal valve is the door right between your small and large intestine. And when it's not functioning, and there are a number of reasons, and we can tell you what they are if you're having that problem, we don't have normal function. We have things that go wrong with us that we couldn't even imagine are coming from that area. Tinnitus, ringing in the ears, very common symptom that goes along with an ileocecal valve problem. Pseudosinus infections, feeling that your sinuses are infected, and that's coming from that area between your large and small intestine. Dark circles under the eyes, pain in the low back around your sacroiliac joints, in your pelvis, pain in your shoulder, all sorts of things that you would never think of because anatomically they're just not around the area where you're getting symptoms. But we see people come in who are having these problems who have seen everyone else because just like any other doctor, someone's complaining of an area in their shoulder, someone's complaining of tinnitus, someone's complaining of low back pain, you look to that area. But sometimes it's not coming from that particular area. Sometimes it's coming from your gut. So, little commercial. We're available at 561-863-8779. You can come in for a free 15-minute evaluation. When you come in with certain complaints, we're going to go right to work at finding why you're having these dysfunctions and help you with an understanding of how you can return to 100% optimal health. So give us a call. It's free. The only thing it's going to cost you is your time, and it won't be wasted, I can promise you. 561-863-8779. You think of anything else? Because I think I've pretty much covered everything with the gut.
I think you've covered
All right.
it. We look forward to hearing from you.
So we covered knee pain, we covered ankle pain, we covered leg pain, we covered low back pain, disc problems, all sorts of different things. And today on this show, we talked about gut health. And we invite you to come and see us once a week. We're on YouTube, we're on Spotify, we're on Apple. And we look forward to serving you in any way that we possibly can. Again, we're sponsored by All American Wellness, and we're brought to you on behalf of the efforts of Christian Perillo and Ben Castro, producer extraordinaire, and Podcast Junkies, podcastjunkies.com. Get in touch with them and come back next week. We'd love to see you. In the meantime, I wish you good health. Bye-bye for now.